Miss Shortridge?
Yes.
Hello, my name's Steven. I'm the X-ray technologist. I'm going to be assisting the radiologist with your exam today. Okay. Just want to go over a few things with you. Can we start off by just verifying your full name?
Danielle Cherie Shortridge.
And your birthday?
March 12th, 1987.
Perfect. And you know what exam you're having today?
The IVU.
Okay, perfect. Just to give you a little bit of background on that, IVU just stands for intravenous urogram. So that's just an exam that we use a contrast agent. Contrast agent is simply a substance that we add to the body to help visualize the internal structures as well as show kind of the functionality of those structures. It is iodine based in this procedure, and it will be added intravenously, and that'll be in the back of the hand, okay? So when we do that, you will probably feel a little bit of a warmth in that area and maybe have a little bit of a metallic taste in your mouth. Completely normal, okay? Have you ever had any adverse reactions to iodine before?
Nope.
No? Okay. With that, if for some reason you feel like there's a different symptom than what we've already talked about, the warming and the metallic taste, just let us know. It could be something like nausea or itching. Just let us know. It just is a change that we should know about, okay? Before we go any further. At this point, are there any questions that are kind of popping out to you?
Maybe why I'm getting an IVU.
Okay. I mean, there's quite a few reasons. Some of the main ones, we check for evaluating abdominal masses, perhaps renal tumors or renal masses, upper urinary tract infections. Could be trauma, past trauma that we're checking on, or maybe for a preoperative evaluation, or the functionality of your kidneys, make sure they're functioning symmetrically, anything like that. So there again, there's many others, but those are a few of the main ones. At this point, so we'll continue to talk over the exam. After we're done here, we'll have you change into a gown because we're going to be taking x-rays. So we'll have to get you out of your bra because of the metal in that, and your jeans just because they show up along with the metal in those, okay? So we'll get you changed after we're done here. So the exam itself, we'll leave from here, we'll get you changed, we'll get into the room, and we'll have you lay down on the exam table. The exam table is cold and hard. I do apologize for that in advance. Hopefully you won't be there for too long. It is somewhat of a lengthy exam, but we'll get it done hopefully as soon as possible, okay? When we first lay you down, we'll take one picture of you without the contrast before adding it. Then we'll add the contrast in, and we'll go from there, okay? Were you able to adhere or follow the instructions for preparation for yourself?
Mm-hmm.
Okay, so your diet the last couple of days has been low in fiber and low in diarrhea.
Yes.
Okay, and then last night after midnight, nothing by mouth.
Nope.
Okay, good. And you stayed really hydrated,
Mm-hmm.
correct? Good. That's a really important one for this one. So with that, along with your GFR, which is your glomerular filtration rate, and your creatinine levels, I know those are terms that are probably like, what? But, so those are just show us that your kidneys are functioning well, so we can give you the contrast agent. They'll be able to purify your system of that and kind of excrete those for you, okay? So going back to the actual procedure, so we'll get you onto the table, the uncomfortable one, and we'll take the one image without the contrast. Then we'll go ahead and add that contrast in. Again, you'll feel that warmth, you'll probably taste that metal sensation in your mouth. But again, if anything arises past that, please let us know, okay? After adding the contrast, we'll proceed with quite a few x-rays in different positions at pretty short time intervals, every few minutes, okay? Those you'll be in positions such as just laying on your back, maybe on your side, perhaps in an angle one way or the other, with one side of your body up away from the table and the other in contact with it. There are a couple other things that may happen, probably not, kind of up to the radiologist with what he sees and what he needs to be able to see. And those are dropping the head of the table down to where your feet are higher than your head.
Circulation.
Yeah, we call that a Trendelenburg position. And then, or we can use the table to stand you up completely so we don't have to get you off the table just to do a standing x-ray. So we can do it right there and just stand you up. So the other thing that may happen, most likely not, but it may, is a compression band may be added. It'll be right around your waist area, your hips. That's just to kind of, it stops some of the flow of the contrast through the ureters into the bladder, just to make sure that we get enough of the contrast into the kidneys, okay? So we can make sure that those are functioning.
I'm a little ticklish. Be careful.
We will be as careful as possible. And throughout all those movements and positioning, I'll make sure you're covered throughout, so you don't have to worry about that, okay? And make you as comfortable as possible. After we get those images, we'll let you off the table and excuse you to use the restroom. We'd like you to be able to empty your bladder at that point and then come back for one more image, okay? That's just so we can get an image with your bladder empty. So it'll still have the contrast, but it just helps to have the bladder empty, okay? Other than that, you will be done at that point. We just ask that you stay very hydrated in the next few days, and your body will excrete the contrast itself in your urine. So there's nothing you have to do, just keep hydrated, okay? All right. If you don't have any other questions?
I don't think so.
No? Okay, perfect. Well, then we'll go get you changed and then introduce you to the radiologist. All right? All right, right this way.